Hello, my name is Melissa Supamankle, and I'll be doing my presentation on the prevention measures of cervical cancer for class BIOL316. So here we go. Let's start by going through the anatomy of the cervix. So what is the cervix? So the cervix is basically a cylinder neck of tissue which connects the vagina to the uterus. It's about 1 inch in diameter. It's made mostly of cartilage and covered by smooth tissue. The exocervix, which is also called the ectocervix, is the outer part. It's usually the part that doctors can see when a woman is getting her Pap smear. The os is the little opening between the uterus and the vagina. And then the endocervix, which is also called the endocervical canal, is the tunnel through the cervix. So what role does the cervix play for women? It's basically a passageway for many different things, menstrual fluid, sperm, and of course, babies. It also is the protector of the uterus and also the upper reproductive tract, which includes the fallopian tubes and the ovaries. It also protects the fetus from pathogens and bacteria. And it also promotes fertility because the glands produce mucus during the fertile stages of the menstrual cycle. Here's a quick overview of cervical cancer itself. So cervical cancer is when the normal cervical cells gradually develop precancerous changes, which turn into cancer. According to American Cancer Society, doctors use several terms to describe these precancerous changes, including cervical intraepithelial neoplasia, which is CIN, squamous intraepithelial lesion, SIL, and dysplasia. 9 in 10 cervical cancers are squamous cell carcinomas, and most other cervical cancers are adenocarcinomas. And here I have a picture of different stages of cervical cancers, starting from early stage, which is on your left side right here, and then the late stages where the cancer has also spread not only throughout the cervix, the endo and ectocervix, but also to neighboring tissues such as the vagina and pelvic wall. Some more facts about cervical cancer is that it's the second most common type of cancer affecting women worldwide. In 2008, the number of new cases of cervical cancer was estimated at 530,000, and 275,000 deaths were attributed to this disease. That's quite a lot. Here are some risk factors for cervical cancer. The number one risk factor would be acquiring human papillomavirus, the HPV virus infection. Your chances are higher when you have multiple sexual partners. A chlamydia infection can increase your risk for cervical cancer. Family history. If anyone in your family has had cervical cancer or any type of cancer, you are at a higher risk. Also, smoking and immunosuppression, because your body is not able to combat the HPV virus. Now, signs and symptoms of cervical cancer can be vaginal bleeding between menstrual cycles, like spotting, or longer and heavier menstrual cycles than your usual, pain and bleeding during intercourse, increased vaginal discharge, and bleeding after menopause. These can all be signs and symptoms of cervical cancer. So if your patient describes any of these signs or symptoms to you, please advise them to seek medical help and follow up with their OBGYN doctor. All right, so Here's the main part of my presentation, is the prevention of cervical cancer. So what can we do to prevent cervical cancer from happening? Well, with multiple sexual partners, you always have to remember to use condoms to reduce your risk of contracting HPV. Delaying the first intercourse may help prevent cervical cancer. Also, having fewer sexual partners. Avoiding smoking will always help deplete your chances for any type of cancer. Getting vaccinated against HPV, such as the Gardasil shot, may also reduce your chances. And the number one thing is to remember to get your regular Pap Smear test screening. That is very important. Other risk factors, other prevention would be to keep very, very close attention to your own body, making sure that you know what's regular for you and what's not regular, so that when something irregular happens, you can report it to your healthcare providers. Now, prevention of cervical cancer. First, we should start off by educating medical students and healthcare providers, especially male healthcare providers. This is because females are slightly more aware of cervical cancer because we have cervixes and our male counterparts do not. So we're more susceptible and also acceptable of treatments and preventative measures for this type of cancer. An interesting article that I read had a questionnaire. A questionnaire was given among medical students at 6 different universities regarding knowledge and perceptions of HPV, cervical cancer, and HPV vaccines. The results were quite alarming. 14.4% to 29% of these medical students felt that HPV infection was necessary to cause cervical cancer. Now, that's a really low number because it should be a bit higher than that, because HPV infection does lead to cervical cancer, and only 29% of them felt that was true. And less than 50% agreed that cervical cancer could be prevented by HPV vaccine, which means that 50% or so would not advise their patients when they are practicing their medical doctor's license, would not be suggesting their patients to receive the HPV vaccine, which is kind of alarming also. 80% thought cervical cancer could be prevented by screening. And this should be 100%, because cervical cancer could definitely be prevented by annual screenings, by regular Pap smears. So these percentages should be a lot higher. So the first step of preventing cervical cancer is to educate our medical students and healthcare providers, because the medical students are going to be the future of our healthcare system. So we want them to be highly educated on the preventative measures for cervical cancer. Most providers report cervical cancer prevention as a priority, which is great. Pap smear test for screening, 86% agreed. Knowledge of screening guidelines, and more than half reported that annual screening is most effective. Here's a quote from one of my articles that I thought was very important. Cervical cancer can be effectively controlled through primary and secondary prevention, such as cervical screening and prophylactic HPV vaccination. Since the Pap smear test was introduced for routine screening, a substantial decline has been witnessed in cervical cancer death in developed countries in the last 4 decades. This is huge. This is why we must educate medical students plus our current healthcare providers that preventative measures and keeping all scheduled Pap smear tests is very important to preventing cervical cancer from occurring and also HPV infections. Okay, so Dr. Pap and the Pap smear. This is one of the preventative measures that is very important. It was established by Dr. George Papanicolaou, which is also called Dr. Pap, in the 1920s. It's a screening test for cervical cancer, where cells are scraped from the cervix and then examined under a microscope. It's performed every 3 years, beginning at the age of 21 to about 65 to 70 years of age. And as long as you have 3 negative tests within the past 10 years, you, from 65 to 70, you don't have to schedule any more Pap smears. Every 5 years, if you're over 30 with normal results from both Pap smear and HPV test. Now, the Pap smear can be a little intimidating for those who haven't had one or haven't had one in a while. So I found this neat little video that kind of shows you what to expect on your Pap smear day. So I'm going to play this for you.
A cervical smear is an internal examination which is primarily done for early diagnosis. To make a cervical smear, rely on the examination. The assistant will do the scheduling before the examination.
Okay, so that's basically the ins and out of what you can expect when you go in for a Pap smear. I know the video says ages 30 to 60, but it's always better to get early preventative care at the age of 21. Okay, here's another quote from one of the other articles that I have researched on about Pap smears. Cytology-based screening with the Pap smear test has essentially reduced cervical cancer mortality in the US and other developed countries. However, that has not been the case in low and middle income countries, where death rates from this disease have increased or remain unchanged. So with this being said, the Pap smear test does reduce mortality rates in the US and developed countries, but we still need to do more preventative measures for lower and middle income countries. This is where our other preventative measure comes into play, the HPV vaccination, such as Gardasil or Cervacin. It's not a live virus. It's actually partial parts of the HPV virus it stimulates our immune system to make antibodies so that if our immune system detects that there is HPV infection within our body, then we can combat them with the antibodies that the vaccine has stimulated our bodies to create. It is 3 doses, which are 3 months apart from each other. It's recommended for girls 11 to 12 years of age or 13 to 26 years of age if they do not receive 3 doses in their younger years. Males may also get the HPV vaccine from the ages of 9 to 26. Even though males do not have cervixes, they can still be carriers of the HPV infection, and they can still have HPV infections, which can spread to their female partners. So it's better to get everyone vaccinated against this. Like I said in the slide before, lower and middle income countries are not finding relief from regular Pap smear examinations. So the HPV vaccine may help with this because it allows the population to be vaccinated against the HPV infection. So there are lower cases of the HPV infection, thus lower cases of the cervical cancer. So a summary of my presentation. Number 1 is to educate the medical students and healthcare providers about cervical cancers, HPV, and different preventative measures, because medical students are the future of our healthcare, and thus they should be fully educated on all these different preventative measures and what works, which is having scheduled and keeping the scheduled papilloma smear tests. Also educate the patients on several things such as risk factors for HPV and cervical cancer, signs and symptoms of cervical cancer, keeping all scheduled Pap smear appointments, and the HPV vaccination. If patients have any questions, make sure you get them the right resources to answer those questions. And lastly, education about preventative measures for cervical cancer significantly reduces the mortality rates of patients diagnosed with cervical cancer. So education is a very, very important part of the preventative category of cervical cancer. It's very important to educate our patients about Pap smears and also the HPV vaccine to prevent cervical cancer from arising. But it all starts with educating our medical students and healthcare providers to suggest these preventative measures to patients. So that's my presentation. And here's the site that I got my information from. And thank you very much.